Welcome. My name is Julia Buss, and on behalf of the Center for Occupational Environmental Health, I'd like to welcome you to our first webinar of 2018, which is on the topic Smoke is Smoke, the Effects of Marijuana Legalization in the Workplace. That's presented by Meryl Levezzo and Myra Miranda. But before we get started, I just wanted to go over some housekeeping items first. You'll be muted during the presentation, so if you'd like to ask a question, please enter it into the online chat or Q&A that you'll see on your computer screen. At the completion of the presentation, the presenters will spend about 5 to 10 minutes answering your questions, so please do enter any questions you may have into the chat, and I'll make sure that I ask the presenters your questions at the end. There is one continuing education contact hour available for this webinar for a fee of $30. So if you wish to obtain credit, you need to register at coeh.berkeley.edu and also complete the evaluation from the webinar, and then you'll be emailed your certificate of completion. Also, to let you know, the webinar is being live streamed on Facebook and YouTube and will be available to watch on both those sites after the live recording ends. So at this time, I'm very pleased to welcome our presenters who join us today from the California Tobacco Control Program. Meryl Levezzo and Myra Miranda. They're both policy analysts in the Tobacco Control Program in the Strategic Planning and Policy Unit. They're both experienced public health professionals, and we're very pleased and honored to welcome them to today's webinar. Thank you for joining us and for sharing your expertise. So at this point, I'm going to hand over to our presenters for today.
Thank you, Julia, and thank you, Michelle, and everyone for joining us today. I'm Myra Miranda, and the title of our presentation is Smoke is Smoke, the Effects of Marijuana Legalization in the Workplace. But before we get started, we wanted to share a little bit of who we are.
Thanks, Myra. Good morning, everyone. My name is Meryl Levezzo. I am the person on the right-hand side of your screen. We wanted to kind of briefly talk about our background to set a little context to our presentation. Myra and I are both fairly new to work at the California Tobacco Control Program, which is in the Department of Public Health. I joined about 9 months ago, and prior to that was working at UC Davis as a sexual health and mental wellness educator. We are both very much building our subject matter expertise in the intersections of marijuana use and tobacco control.
And I'm Myra Miranda, so I'm the one on the left of your screen. I actually have about 4.5 years of local tobacco control experience and recently joined CTCP here at the state. So I've been here about 6 months. The marijuana is still very new to me.
Great, and today we will be talking about 5 main topics. First, we'll give a little background of California Tobacco Control Program. We'll then talk about California's marijuana landscape. We'll look at a little bit of data around marijuana use and exposure to marijuana secondhand smoke. We'll then talk about the health effects of marijuana secondhand smoke, comparing it to tobacco secondhand smoke, and then we'll finish up with a summary of the California cannabis law, which is Proposition 64. We do not have any conflict of interest to disclose.
So about the California Tobacco Control Program, or CTCP, it was established by Proposition 99, the Tobacco Tax and Health Protection Act of 1988, which was a 25-cent tax added on to cigarettes, of which 3 cents is used to fund CTCP's efforts, including funding local health departments and community organizations, a cutting-edge media campaign, and tobacco-related evaluation and surveillance.
And since its inception in 1988, CTCP has achieved many triumphs. I'd like to highlight a few here. Today, fewer than 1 in 8 California adults smoke cigarettes, which is down from 1 in 5 when the program started. More than 1 million California lives have been saved as people quit and fewer people start in the first place. And from the years of 1989 to 2008, $134 billion have been saved in healthcare costs. Significant changes in social norms around smoking have happened since the late 80s, where now it is really taboo to see someone smoking a cigarette inside. And we're really proud to say that about 100 jurisdictions across California have very strong, comprehensive smoke-free laws, with hundreds of other jurisdictions having some type of smoke-free policies in their communities.
Nearly 30 years later, Californians overwhelmingly voted for Proposition 56, a ballot initiative to raise the tax on tobacco products as a way to prevent youth from smoking and fight the impact of tobacco on our state's residents. The California Healthcare Research and Prevention Tobacco Tax Act, or Proposition 56, increased the state's tobacco tax by $2 per pack of cigarettes and an equivalent amount on e-cigarettes and other tobacco products. 15% of these funds the funds that CTCP receives is geared towards not only reducing tobacco-related disparities, but ending disparities overall. A few of our program priorities, the first one being limiting tobacco promoting influences. So efforts in this area seek to curb advertising and marketing tactics. The second one is reducing tobacco secondhand exposure, tobacco smoke residue, or third-hand smoke, tobacco waste, and other tobacco products. So efforts in this area address the impact of tobacco use on people and the environment. A third priority would be to reduce the availability of tobacco. So efforts in this area address the sale, distribution, sampling, or furnishing of tobacco products. And finally, promoting tobacco cessation. Efforts in this area include a provision of free cessation assistance through the California Smokers Helpline.
So smoking bans in indoor places, including places of work, protect non-smokers from exposure to secondhand smoke and is one of CTCP, the California Tobacco Control Program's priorities. California has a broad smoking definition that captures all forms and acts of smoking, whether that is a tobacco or other plant product. And that is in the Business and Professions Code, section 22950.5 that I resourced at the bottom of this slide. Combustible products include cigars and cigarettes. Electronic smoking devices include e-cigarettes and vape pens. California law prohibits smoking in indoor workplaces like restaurants and bars, private residences serving as daycare, and public or private offices. The infographic on the right-hand side of the slide is available on our website and is a nice summary of California's clean indoor air laws. So smoke-free airs are really important because smoking and secondhand smoke, we know, cause life-threatening diseases. It's estimated that nearly 40,000 Californians die each year from diseases caused by smoking and from secondhand smoke exposure. So our smoke-free air laws are really important because they protect non-smokers from the harmful effects of secondhand smoke exposure. But they also do something else. They reinforce the social behavior that smoking is unhealthy, and it helps folks who have quit smoking to stay quit because folks in their environment are also not smoking. So state smoke-free laws are really great at setting sort of the floor for indoor spaces and workplaces, but are somewhat limited when it comes to outdoor areas. So local communities have the authority to adopt policies that complement the state law by covering more of the outdoor spaces and other spaces exempted from state law. And these places could be like entryways around businesses, recreation areas such as parks and beaches, and other locations where people congregate, such as bus stops or maybe a public event. We wanted to highlight 2 cities in California who recently passed very comprehensive smoke-free laws. The first on the left-hand side is from May of 2017, which is Laguna Beach City. Their city council expanded a ban already in place for parks and beaches to the rest of their city, and it now bans smoking, including e-cigarettes and marijuana, throughout the city, including sidewalks, bike paths, alleys, and parking structures. And then the right photo highlights Paso Robles, who expanded a ban from 1988 that just bans smoking in meeting facilities to the entire city. So there's just about nowhere in the city where someone can smoke tobacco, ESGs, or marijuana in the public. And I really like this photo because it showed young people being engaged with their city council and working on passing smoke-free policies in their community.
So California's marijuana landscape. So just a bit of a background, the Adult Use of Marijuana Act, or ALMA, legalized use, possession, and sale of marijuana to adults 21 years of age or older from businesses that have been properly licensed by the Bureau of Cannabis Control. ALMA, to say the least, has been a curveball. And to add to this, marijuana and its legalization has always been on the radar of CTCP, and as it got closer to legalization, the concern was its prevalence and its accessibility and its overall impact on how we look at the smoking landscape here in California. From personal experience working at the local level, the concern from the general public was that they didn't know too much about marijuana secondhand smoke. They were very aware that secondhand smoke from combustible tobacco products or e-cigarettes was harmful, and they made efforts to avoid it, but they weren't too sure about marijuana. And this was more apparent in apartment complexes where there were policies already in place for smoke-free apartments, so that included tobacco products, but there was still this like weird gray area where marijuana was just a concern, and residents didn't know how to react to it. And in most cases, or in certain cases, apartments can be a place of work, and so that adds another layer to the landscape.
So the California Tobacco Control Program and its Oversight Committee, the Tobacco Education and Research Oversight Committee, also known as TROC, is concerned about the convergence of tobacco, vaping, and marijuana, since the intersection of these products complicates the smoking landscape in California. So there is co-use happening of marijuana and tobacco products. Blunts, for example, is a tobacco leaf wrapped around marijuana filling. Electronic smoking devices, such as e-cigarettes, can also be used to deliver cannabis in addition to nicotine. And burning both marijuana in these products, or vaping marijuana, produces a secondhand smoke. And marijuana smoke is actually on Proposition 65 list of being known to cause cancer to the person who's smoking it, but also can increase the risk of cancer for folks who are around the smoke from the vape or the burning of the marijuana. So it's critical that tobacco prevention efforts capture and address the harms from this, quote, triangulum of the intersection of tobacco, marijuana, and electronic smoking devices.
So a little bit about marijuana use and data exposure data, sorry. So who is using marijuana? And how prevalent is marijuana use, especially among young people in California? So the data that you are seeing here, the graph, is data from the California Student Tobacco Survey. And these are results from 2016. And these were also, the survey was taken prior to the legalization of marijuana. And so The California Student Tobacco Survey surveyed students between the grades of 8 through 12 from about 50,000 schools, and the schools were randomly selected. And so what we're looking at here is that high school students are using marijuana. There's a significant amount of co-use. And what we mean by co-use is they're, again, smoking marijuana in possibly a tobacco product. So it's masking the taste of tobacco, enhancing the flavor of the marijuana, creating a better buzz. The concern here is that these tobacco products and the co-use still contain nicotine. And nicotine is highly addictive, as we know. So co-users are likely to develop an addiction to tobacco products. And again, these rates could be higher now that marijuana has been legalized. So there is a greater probability that there is a higher rate of co-usage.
So similarly, we look at marijuana and tobacco use among adults. This came from an online survey from 2017 with a sample size of about 3,100 adults ages 18 to 64. The data show that among adults, cigarette and marijuana use is actually fairly similar, and co-use is 4%, which is about half of what we saw in the previous slide among adolescents.
And methods of use. So as you can see here, the majority of marijuana consumption occurs through either smoking or vaporizing. And then there are smaller percentages for eating, dabbing, or drinking it.
And looking at data around exposure to marijuana secondhand smoke in the past 2 weeks, you can see an increase in the number of adults who reported being exposed to marijuana secondhand smoke from 2016 to 2017.
So data from 2016 and 2017 show overwhelming support, or adults surveyed show overwhelming support or strong support against marijuana and for marijuana smoke-free environment. Sorry.
But interesting, sort of despite supporting smoke-free environments, a significant number of adults are being exposed, and most of the exposure is happening in public spaces. So we've got about 30% happening on sidewalks, 23% in the home, around 6% in the outdoor beach park area, about 6% in workplaces, and then in malls and stores around 5%.
Last fall, CTCP ran a secondhand smoke ad campaign to raise awareness about the harms of drifting secondhand smoke in multi-unit housing. As a result of these ads, we've received a large volume of emails with a portion actually related to marijuana, and we wanted to share with you the ad that kind of triggered all of these questions for us.
Millions are still exposed to the dangers of secondhand smoke. And some of them can't do anything about it. But you can. Protect your family. Visit tobaccofreeca.com.
Okay. So as of February 5th, we've received about 235 emails as a result of these ads airing, with about 20% being related to secondhand smoke, marijuana secondhand smoke. So that, as you can already tell, the public is really skeptical about marijuana secondhand smoke exposure, and they do have questions, and so there is a need for education. And going with that, we wanted to talk a little bit more about the health effects of secondhand smoke exposure. So perception of harm, and there's this perception that marijuana is somehow less harmful than cigarettes are. So we know that young adults know about the harms of tobacco. They've been exposed to tobacco prevention education, but they're not aware of the harms of marijuana. The general public avoids tobacco secondhand smoke, but many still think that marijuana is safer, or marijuana secondhand smoke is safer. Both plants produce secondhand smoke, and both are associated with adverse health outcomes. And I wanted to talk a little bit more about the photo that you see on there. This was a result of a Google search, and it served two purposes. One of them was to provide a photo for this presentation, but the other was to really highlight what the perception of the public is when it comes to marijuana and tobacco. So we see in the photo that there's a cigarette, and we know that it has all these cancer-causing agents in it, and we know that it's deadly by the skull and crossbones that's also highlighted there. And then there's a joint there, and its contents, according to this diagram, are weed and more weed. So there's just this perception that it's healthier, and it's from the earth, and it's organic, and it couldn't possibly cause the same health effects that smoking a cigarette would.
So this was a quote that inspired the title of this presentation. It's from Matthew Springer, who's a researcher at the University of California, San Francisco. And Matthew writes, "Smoke is smoke. Both tobacco and marijuana smoke impair blood vessel function similarly. People should avoid both, and governments who are protecting people against secondhand smoke exposure should include marijuana in those rules." So Dr. Springer and colleagues conducted a study using a rat model that showed, similar to tobacco, marijuana secondhand smoke exposure impairs vessel function and has long-term health effects if that exposure occurs over a long period of time. Therefore, the California Tobacco Control Program is very supportive to make sure that marijuana use is consistent with clean indoor air and smoke-free laws, including those that affect workplaces. So what is actually in marijuana secondhand smoke, especially what makes it harmful to our health? Results from laboratory testing under standard conditions found that secondhand marijuana smoke contained more tar, more ammonia, and hydrogen cyanide compared to tobacco secondhand smoke. Marijuana secondhand smoke contains many of the same chemicals and carcinogens found in tobacco smoke, and 33 of the compounds in marijuana smoke are actually also on that Proposition 65 list of chemicals known to cause cancer, including compounds like lead, mercury, formaldehyde, and cadmium.
So again, just the concern over marijuana secondhand smoke, and one of the things that we've learned is about secondhand high exposure. So in a systematic review of 15 human studies published in November of 2017, of which I've listed the source at the bottom of that slide, non-smokers exposed to marijuana secondhand smoke reported a secondhand high. This high was stronger when the tetrahydrocannabinol, or THC, was higher. And so in comparison, the user who was smoking a marijuana that had a higher content of THC also reported a stronger high, which would then lead the person exposed to the secondhand smoke to also receive a stronger contact high. THC, or THC metabolites, were found in bodily fluid, including saliva, blood, and urine. In this review, human subjects in one of the studies reported eye irritation when exposed to marijuana secondhand smoke, which a similar link could be made with secondhand smoke exposure and eye irritation as well, because we know that secondhand smoke is an irritant, and people are often allergic to secondhand smoke. So another question that has come up is, ventilation for acceptable air quality. So very similar to tobacco smoke, tobacco secondhand smoke, and in line with the Surgeon General's report on smoking, there is no safe level of exposure. So in other words, ventilation does not make the exposure any less harmful. The American Society for Health, Refrigeration, and Air Conditioning Engineering, or ASHRAE, expanded their definition in 2015 of environmental tobacco smoke to include marijuana smoke and emissions from electronic smoking devices, or e-cigarettes. And ASHRAE also concluded that the ventilation systems cannot eliminate environmental tobacco smoke.
Okay, so for our last topic that we're going to get into today is the California cannabis law and sort of understanding Prop 64 and how it impacts the smoking landscape here in California. So in November of 2016, Proposition 64 legalized use and possession of marijuana or cannabis to adults at least 21 years of age, and sales to adults 21 years of age has to come from a business that's properly licensed by the Bureau of Cannabis Control. And as many of you know, licensed sales began just last month, January of 2018. So Prop 64 includes provisions that aim to protect non-smokers from exposure to marijuana smoke, but there are exemptions that could challenge California's smoking landscape. So Prop 64 prohibits smoking and ingestion of cannabis in any public place with specified exemptions. Smoking cannabis in locations where tobacco smoking is prohibited. It prohibits smoking within 1,000 feet of school, daycare center, or youth center while children are present. It prohibits possession of open containers of cannabis while the person is driving, operating, or riding in a passenger seat of a motor vehicle, boat, or aircraft. And it prohibits consuming cannabis while riding as a passenger in one of those vehicles.
So a couple of these exemptions were of concern, particularly those that allowed smoking in the retail environment. So Proposition 64 gives localities the authority to decide whether or not they want their dispensaries or, to allow smoking in them, as well as temporary marijuana events. And these events, from my understanding, have been that they can occur either in the indoor or an outdoor setting. So they both still would cause some form of exposure to a non-smoker. Local jurisdictions permitting smoking in dispensaries and temporary events could possibly cause a rollback in smoke-free events in fairgrounds and communities that have adopted these policies. Another example has been San Francisco. Their Board of Supervisors recently approved an ordinance that would authorize medical marijuana dispensaries to provide an indoor space or on-site smoking, but it was limited to a year for now. In part of my work here at CTCP, I assist in the staffing of TROC, and specifically they have a subcommittee that is looking at the crossover between marijuana and tobacco, and this is one of those items where there is some concern, especially its impacts on social norms. The additional concern here is that most people are, again, aware that tobacco products and secondhand smoke are harmful to one's health. However, due to the perception that marijuana is somehow less harmful and the lack of research, the concern for use and exposure is not the same as it is with tobacco.
So local authority. As we mentioned earlier, Proposition 64 grants locals the authority to pass smoke-free laws in their communities. So despite the potential rollbacks that Myra talked about, we're seeing a few cities sort of taking the issue into their own hands and passing strong smoke-free policies in their communities that address smoking of all kinds. So locals can can determine if smoking is allowed in the retail settings, as Myra mentioned. They can also choose to create policies that restrict or ban marijuana sales and marijuana use completely in their jurisdictions. And two cities we wanted to highlight that are doing some great work are the city of Ultras, which is part of Modoc County, who adopted a smoke-free outdoor dining and outdoor sidewalk law that prohibits smoking of tobacco, marijuana, or vaping within 20 feet of any business. And then the second city in Orange County, Dana Point, passed a citywide smoking ban that prohibits smoking or vaping in the public. So we do have some policy guidance coming from TROC, which is the Tobacco Education Research Oversight Committee, and NACHO, the National Association of County and City Health Officials, with policy statements that guide solutions at the local level to protect smoke-free laws and to protect their communities from the harmful exposure of secondhand smoke, including from marijuana. So to broadly highlight the three recommendations from TROC, they are to have comprehensive marijuana education and prevention campaign to protect young people and non-users and the general public about the harms of marijuana use, which I think we highlighted today. There's still a perception that marijuana is less harmful than tobacco, so that education campaign is needed. The second recommendation is that marijuana use should be restricted just like tobacco and be consistent with clean indoor air and smoke-free laws. And third, tobacco-related types of policies which protect the public and help prevent the uptake of tobacco products by young people should be applied to marijuana use. And then NACHO released a similar policy statement in 2017. So the TROC statement actually came out, as you can see, September of 2016, sort of before and in anticipation of Prop 64, while NACHO just released their policy guidance last fall of 2017. But they're also encouraging local health departments to incorporate marijuana into the existing smoke-free indoor and workplace laws.
In applying some lessons from tobacco control to marijuana, we definitely need more education and research. Awareness needs to be raised on the similarities between the two products, and applying lessons that we at Tobacco Control have learned to marijuana that may help shorten the learning curve. Additionally, we recognize that we are the Tobacco Control Program, and there is another program specifically created to address marijuana. However, there is an overlap on some of these issues, such as secondhand smoke exposure, and we are looking to partner with others to address the issue and hope that there are some creative solutions in which we can address both of these plans. Thank you very much, and our contact information is listed there, and we're ready for questions.
Thank you very much for that presentation. Thanks to the audience for entering in your questions. One question that we had early on was about what constitutes secondhand exposure, like if children are around a person who often smokes and the smell lingers on their clothes, or they're in a room where a person has previously smoked. Just sort of, is there exposure and how much for children?
So is the question, could you repeat the question? I'm sorry.
Yeah, sure. I think it's to do with kind of what actually counts as secondhand smoke exposure. So if somebody has smoked in a room previously and they're no longer smoking there, or if they have the smoke smell on their clothing, would that still count as an exposure?
Yes, it would actually count as an exposure. It wouldn't necessarily be secondhand smoke. It would actually be more along the lines of third-hand smoke. So a lot of the time, so secondhand smoke is smoke that's exhaled from the smoker, as well combined with the smoke that's coming from the product that they're using. Third-hand smoke would be the residue that's left over on surfaces or anything that can absorb the smell, so clothes, hair, furniture. So in certain cases, or in most cases, we are concerned with children being exposed to third-hand smoke because they're the ones that are probably falling on the floor, climbing on furniture, and if there's been smoking in the room and the residue has rested, they can expose themselves that way.
Yes, yes, that's the interesting thing of third-hand smoke exposure too.
And
Another,
Julia, this Meryl, I just want to add, we're still there's not a lot of research about third-hand smoke exposure from marijuana secondhand smoke, that has lingered. We're getting more on tobacco, but the marijuana research is still very much in development and still coming.
there's a question about research into secondhand marijuana smoke, which is, do the organizations employing these people hold DEA registrations to allow their exposure to a federal controlled substance?
That is a great question. If you could send it to us, we could do the research on that. But that's another example of where marijuana is in a gray area, because even though California has legalized it, it's still a Schedule I drug and subject to all these restrictions by the federal government. So, and I think that's also a barrier in the research that we have access to right now. But please send us the question and we will find an answer for that.
Yes, I mean, I was thinking before about the funding. If there's such a need for research, yet as a controlled substance at the federal level, how does that impact just the resources for research to take place even? Another person made a comment of, my coalition is working on smoke-free multi-unit housing. Our issue is that because Prop 64 bans all public consumption of cannabis, jurisdictions are becoming wary about smoke-free multi-unit housing policies because that would leave adults without any place at all to smoke, unless they're wealthy enough to own their own home. Do you have any guidance or discussion about this?
I think you could also send us that question. We don't entirely know. That's again another gray area that we're struggling with, and we're still trying to learn how to find a happy medium with that sort of stuff. So we can please send us a question and we will answer it offline.
Yes. Yes,
I think
sure.
it highlights sort of a tough area because we're really concerned about reducing exposure to non-smokers, right? And as we saw in that video tried to highlight how smoke can travel through walls so easily and expose young children or other people who might be sick, or just really anyone who doesn't want to be exposed to smoke, to that secondhand smoke exposure. And so, we're really concerned at a population level of reducing exposure to that smoke. And so policies that sort of further that, I think, are really important. But we also understand communities have their own sort of specific concerns, and coalitions have to sort of work together with their community to figure out what is best for them. But we definitely still want to see that exposure as much as possible, protect folks, especially like little babies, like this video showed, who this could be potentially really harmful for them, and they don't have any say really on the smoke that can come in through vents and stuff like that, through other neighbors' use.
Another question just asked for clarification about the carcinogenic potential of secondhand marijuana smoke, and if you had a reference for that evidence.
Yes, we can go back to that slide, but Proposition 65 is mentioned. going. Yeah, so OEHA, which is the Office of Environmental Health and Hazard Assessment, has a fact sheet about marijuana smoke, and they can be found at p65warnings.ca.gov, and it talks about the 33 of the compounds in marijuana smoke are also on the list: arsenic, cadmium, lead, mercury, and that's the site for that, the reference.
I have an interesting comment from one of our attendees to say, let's all remember that medical marijuana can be consumed orally. It's almost never necessary to smoke it.
Yes.
Yes. Thank you.
Another question is, do you have information on cannabis workers' exposure to chemical substances in the plants, for example, trimmers and people manipulating it at dispensaries for 8 hours a day?
I don't have the reference on me right now, but I could send something after, which I came across in just doing my research for this presentation.
Sure, that would be great. Thank you. Yeah, I remember at the beginning you had said that 6% of people surveyed reported exposure to marijuana at their workplace, and I wondered if you knew which were the workplaces that were more likely.
Yes, unfortunately, the question did not get into more specifics than just workplace as a category that people could choose as the location of the last exposure. So that was as specific as we have at this time.
Another question is maybe not so specific to cannabis smoke, but asks, what are the health effects from smoke from fireplaces, fire pits, or chimney smoke?
Sorry, we don't have, I think, information on that specifically, but the resource I mentioned earlier perhaps might, and that is the Office of Environmental Health and Hazard Assessment, which is in the California Environmental Protection Agency, the Cal EPA, might have more information about the emissions from fireplaces.
Another question asks if we have reference material regarding workplace policies for secondhand smoke exposure, I'm assuming. Well, anyway, regarding workplace policies. But actually, I know that in our one-day class that we're putting on March 29th, we have a speaker from Colorado who's going to come and speak to a bit about workplace policies around the legalization of cannabis then, but just don't know if you have any other recommendations of where to look for help in that regard.
The California Tobacco Control Program has this really neat infographic on California's clean indoor air laws, and we would recommend that they take a look at that fact sheet, and it could also lead them to other resources.
Yes.
Bureau of Cannabis Control, I would suggest.
And also, I just wanted to point out to the attendees, I mean, thank you so much to our presenters for being willing to answer questions offline, but if you could send them to their email, because we don't have, you know, your specific question tied to your specific email to make sure you get the answer you're looking for. So if you do have a follow-up question, our presenters have been kind enough to share their contact information here on the screen. If you can ask them specifically afterwards, that would be, make sure you will definitely get your answer.
Thanks, Julia.
There's a comment from somebody saying that it's interesting the state of California's conflict by legalizing marijuana and also at the same time declaring it a cancer-causing agent. That's not a question.
Noted.
As you can see, it puts an interesting spin on how we approach it.
Yes. Yeah, and it seems such a difficult situation where there's maybe policies might reduce exposure as local authorities implement bans, etc. But yet at the same time, when you think of this co-use of tobacco and marijuana, I wonder what effect that will have in the long term of increasing tobacco addiction amongst young people. And I wondered, are there actual products sold that are co-use, that are sort of pre-packaged with tobacco and marijuana now, or are those all sort of homemade?
In my experience, there's, or in just in the work that I had done prior to arriving here, usually they're not prepackaged. It could have changed now that marijuana is legalized, but my point of reference would be blunt wrappers or blunts. The use of blunts, they're emptying out a little cigar and placing marijuana in them, or they're just buying the wrapper for it and placing marijuana in that way. There's been, I've known to see or hear of like marijuana being used in e-cigarette devices. So they're separate, but they're using them in tobacco products.
Mm-hmm.
Another question we have is California partnering with other marijuana legalized states to develop a research agenda to avoid duplicative efforts?
I don't totally know the answer to that. I think we are. I know we are kind of talking to those other states and starting to think about planning like sort of summits to get folks together, and maybe hosting that in one of our states. And so I know there's talking happening from one to the other. I don't know about the sort of tying in the research part. I would hope so, because we did talk about sort of the barrier of the research, of doing research with marijuana. So I would hope that lessons and information like that would be shared, but I don't completely know the answer to that.
Yeah, and I mean, that's one of the reasons why we wanted to hold the symposium we have coming up in March, to be able to invite folks from other states to come and talk about their experience, so that, you know, we can really work together and learn from what others have found out, or found out what works or what doesn't work. We have another comment to say that the new regulations, I think that the new regulations ban products with cannabis and nicotine, or cannabis and alcohol. So that's good to know. Hopefully that's the case. So we still have a few more minutes if anyone else has another question they would like to ask of our presenters today. Actually, our next webinar next month will present on cannabis and public health questions and opportunities. And that will be Dr. Amanda Ryman who will present then. And as I mentioned before, we have our upcoming day, the Buzz on Cannabis, Health and Safety in the Workplace, on March 29th at UC Berkeley. And actually, 2018 marks 40 years of the Center for Occupational Environmental Health at UC Berkeley. And so we'll be celebrating in May with a 2-day symposium that's going to take place at the Betty Irene Moore School of Nursing at UC Davis in Sacramento. And it should be a really interesting day, full of what's been accomplished, and yet what challenges lie ahead for California in terms of occupational health. We have a question that, will the slides be made available along with their talking points? And yes, thank you to our presenters today. The slides will be made available, but not the talking points, just the slides from the presentation. The video has been live broadcast on Facebook and YouTube, and it will be available both on our Facebook and YouTube channel. And you can find both of those at our website, coeh.berkeley.edu. So the video will be online, and the discussion part that we're having now will also be part of the video. So you would be able to listen to it again. We just don't have it printed for you. So are there any more questions? Okay, well then I'd like to just take this time to thank our presenters today, and also to everybody who joined us for participating. Our monthly webinar series do take place on the first Wednesday of each month at 10:30 a.m. And so next month will be Wednesday, March 7th at 10:30 a.m. So at this point, I'd like to say, unless there are any more questions, I'll just quickly have a look. No, it seems like we've answered everybody's questions. You know, I had one more before we quickly go, which I just thought of to ask you, which was where, if there were any laws kind of protecting outdoor workers, or if it was as an issue for them. I mean, just thinking of, say, construction workers or agricultural workers who might be smoking outdoors while they're working, but what about secondhand smoke exposure protection for their co-workers? Do you know?
I think it's more up to the local jurisdiction to put those kinds of regulations in place. In terms of outdoor spaces,
Yeah, for outdoor spaces, California state law has some smoke-free policies that would affect the folks that you're talking about, Julia.
Yeah.
But it's not super broad. It's like 20 feet from tot lots, playgrounds, and certified farmers markets, public and charter school campuses, 20 feet from the main entrance or exits of government buildings. So that's sort of what we were talking about earlier as far as the state laws kind of having this floor, but then local jurisdictions have the authority to pass stronger smoke-free policies, including the outdoor ones. And that's really kind of a big concern to protect the workers that you're talking about.
Yes. Oh, well, that's interesting. Thank you so much. I've really enjoyed this webinar and really appreciate your time and work, and all the work that you're doing for us, for all of us Californians. Thank you so much. It's really important, and you save so many lives. So good job, and thanks for Oh, actually, before I completely wrap up, I just got one more question, which is, this may not be the right forum to ask this question, but is the use of marijuana, not medical use, protected for employment? I'm not sure what that question actually is asking. Is the use of marijuana protected for employment? Maybe that's something that...
I'm
No.
wondering if it's a...
Maybe it depends too on the job, because I guess some jobs like nursing, for example, you may not be able to, you may be drug screened, but other jobs may not. So, workers using marijuana on the job or have consumed before work. Yeah, I guess it probably depends on the job.
so they're using medical marijuana?
Not medical or recreational.
They're protected?
Yeah, I'm not sure really what the question means.
If they could send us a question, we'd be happy
Yes.
to do the research and give them an answer.
Oh, yeah, I guess it's just a concern with somebody smoking marijuana while on the job is the question. I'm not sure there would be many workplaces where that could be possible, but.
Right. Like we mentioned though, like local jurisdictions, it's up to them.
So California cannabis law gives employers, the authority to prohibit marijuana.
Okay.
In marijuana use in the workplace.
Okay. So the employer could prohibit marijuana use in the workplace, and if somebody came to work high, then and they're not able to perform the functions of their job, or they're not safe at work. So
yes, the employer can set that policy.
very good. Thank you. Thank you. Thank you. So no more questions. And I'd like to, again, thank you so much for your fabulous presentation, all the work you do. And thanks to everyone for joining us.
Thank you.
Bye.